What's up, everybody, and welcome to another amazing episode of the Automatic Patient Podcast. I am your co-host today, Jordan Comstock. With me, Dr. Dan Nelson. What is up, dog? How you doing?
I'm doing good, man. How are you?
Doing good, man. Excited for today's episode. Last week, we discussed the difference between PPO patients and membership patients, which is a really fun interview. I've seen on the social media threads lately that there's a lot of people actually asking about that. I'm getting ready to go on another podcast next week with just another marketing agency, Gary Bird. I don't know if you're familiar with him. And he posted on, I think, Dental Nachos. He's like, what are you guys' questions? And that was the main question between membership patients and PPO patients. So I'm excited to share our conversation. I'll probably name drop you and tell the audience to go check you guys out too.
They'll be like, "Who's that?
Yeah,
Who?
be like,
Who?
yeah, no,
Who?"
I'll give you websites and everything. It'll be a legit drop.
Dude, what did we do? What did we do with life before podcasts? Like, I don't even know. Like, what
I
was
don't
it?
know.
Out having fun or
I
picnicking? What were we doing? I don't.
probably I've always done a podcast, at least ever since I've launched BoomCloud. I think I started my first podcast in 2016. We were like one of the 5 podcasts in dental, like Mark Costes and Gary Takis. Now there's like hundreds. It's wild.
Oh yeah, you throw a rock, you're gonna hit 15 of them. Yeah.
Yeah. And I consume a lot of podcasts for bootstrapped software founders, and I've actually joined several masterminds uh, because I've listened to podcasts. So it's been always a good benefit for me.
Dude, I've got my Diet Coke. I'm ready to rock.
You're ready to rock and roll.
I'm all juiced up, ready for this.
Sweet. So today we're going to be talking about the Perio Paradigm, which I find fascinating. I think years ago we had somebody come and talk about all the perio issues in dentistry, and we're gonna discuss those with Dan, what you're seeing in the industry and how we can overcome the perio paradigm. So, first question for you: perio is the most undiagnosed or untreated aspect of dentistry. What are the stats on that?
So this is what's crazy about all this is that out of our, so when we first onboard any member into Elevation Association, we do a growth report, and it gives us a really nice, clear snapshot of what's happening within the practices.
Sure.
And almost universally, there's a couple of outliers and there are exceptions to this rule, but almost across the board, every practice we've ever looked into has abysmal perio numbers. And I mean, terrible, terrible. The lowest we've seen is 2%.
Wow.
That was in Utah. I know, no surprise.
Geez, of course. Yeah. That sounds about right.
Yeah, par for the course. But in the best we've seen, we have a member that practices down in Arizona that they actually bought a practice from a periodontist. So her numbers are quite high. They're actually higher than average. They're about 40 in the 40 percentile somewhere. But
patients that have perio.
Yeah, so active patients that are perio patients. So, and that's something that the crappy thing, Jordan, is I would bet that if you were to ask any dentist, like go to a conference, like pick a conference and go to a conference and just randomly like ask, hey, what's your perio percentage? It would be weird to know that off the top of your head, but
they just run away. They're like, oh.
Yeah. Well, but the thing is that I almost guarantee that 80%, it's getting better now, but I bet 80%, 70, 80% of those docs wouldn't even know where to go to find out
to find the numbers.
They're completely ignorant to it. And it sucks because this is one of the problems that leads to what the perio paradigm is. And so, that's one of the biggest issues is that people don't know they have a problem in their practice because they're not tracking data. So they don't have any idea that like, oh shoot, I'm behind in this, or I'm under this, or I'm not doing this. But the benchmark for any practice is 30%. So on any given practice in the United States, your benchmark for active perio patients should be about 30%. So, some offices are more, some offices are less, depending on where you live. But just some other interesting stats is that 47.2% of adults over 30 have some form of periodontal disease. So
me,
possibly, I mean, you never know, right?
Yeah,
get a perioprobe in there. Um, and then periodontal disease increases with age. So 70% of adults 65 years and older have
Mm,
periodontal disease. So just start doing the math in your head and you're going to go, 30% of your practice is kind of a minimal number. It shouldn't be like, oh, this is the target, although for a lot of practices it is.
sure. The
Some other
30%,
information. What's that?
the 30% range of, hey, I got 1,000 active patients and 300 are, is that the right number? Yeah,
Yep.
300 are perio.
Yeah, I mean that's what it should be, you know.
Yeah.
Also kind of some fun facts about perio for those that like data, like me and geeky with data. It's
Yeah.
more common in men than women. It's about 56% of men,
So
38% of
you're
women.
just me? Is it me? I'm worried now.
I mean,
I'm joking.
it's look around, you know,
Yep.
it's
Now I'm like, I gotta go see the doc.
yeah, yeah. If nothing else, I'd like to just inject some paranoia out there. Just freak people out.
I'm
Oh gosh, I'm
joking.
gonna lose my teeth.
Is
Um,
is insurance a big factor in that? Like, is that scary to practice owners to does insurance complicate perio? I guess is the question.
it doesn't help, that's for
Yeah,
sure.
sure.
I think that, yeah, totally,
Hmm.
because a lot of times what happens and is that if your staff gets used to making insurance driven decisions, which is a bass backward way of making decisions, but it happens all the time. They literally will get conditioned to making decisions based on insurance. And let's say somebody is going to run out, they needed some work and their coupon is used up that year. Their sucky dental
Yeah, they're
insurance
very
is used up
expensive
that year.
coupon. Yeah.
So ridiculous. So if that happens, and then they need, 4 quads of SRP 4 times a year,
Yeah,
they're going to be like, well, I can't afford it and I won't do it. I
sure.
don't have any benefits left. I
Hmm.
was talking with my partner yesterday. He came up after seeing a patient. And he said, you know what phrase I hate? And I'm
I
like,
know
no,
what
what
he's
is
gonna
it?
say. Yeah.
He's like, oh, when the patient says, well, I'm out of benefits, so I'm not going to do that.
Yeah.
Like, okay, like,
It's like,
and we were
would you say that
joking.
if your heart's failing and insurance was like, hey, we can't cover this? Like, I'll get to it
Well,
later.
I'm like, what if you have, what if you have like a broken bone, like you bust
Yeah.
your finger, and you're like, well, I'm out of insurance, so
Yeah. So
I broke my leg. It's
I'll get
okay.
the
I'm not gonna,
popsicle sticks out and put some duct tape around it.
yeah. Oh yeah, yeah. I have a gross infection on my thumb, but I'm just gonna leave it alone because I'm out of
Jeez.
benefits.
Yeah.
It, it's just the mindset is insane, and I get that it transcends dental, but it's more
Yep.
prevalent in dental. So absolutely, yeah. To answer your question, 100%, the insurance mindset affects those numbers. As far as like hitting that 30% can be more challenging, and I think it's only 30% a lot because of the influence that. I mean, there's a lot of factors, but I do think that insurance is one of those factors.
Sure. Yeah, I can totally see that. I think I was talking on social media the other day. Somebody posted like, "Hey, why is it was more about health insurance? Like, why are my insurance like premiums $1,000 a month or and beyond, and I don't get very much out of it, and it's just increasing, and I'm not getting much out of it." I'm like, oh, because really, insurance is a product for investors, and they lobby to protect their profits and investors, and it's like the highest lobbied industry in the United States. It can be pretty gross when you look at what they do to industries. So yeah, I can see that impacting a lot of patient mindset and even practice owner mindset. Like if they're, I don't know if they're too scared when there's perio to be done, and they know that insurance is not going to be helpful, and the patients maybe can't afford it, or um, maybe there's that fear, right, of finance. I can't afford my patients can't afford it, so I'm not going to offer it. Ooh,
Yeah,
when
well,
that's not
I
the
mean,
case.
you just segued. I mean, you hit the nail on the head and you just segued into like, well, why do I call it the perio paradigm? Like, what
Yeah,
is the perio paradigm, right? And it's that most offices have a percent of perio patients that have somehow fallen through the cracks, or they're not being treated at all, right?
sure.
Either they were a perio patient and now they're not for some reason. They got switched over to routine prophies,
Hmm.
or they're just not being diagnosed and treated at all. And So the paradigm is this, is that you have a body of patients in your practice currently that are absolutely perio patients. The problem is either you've acquired this practice or maybe you've been in practice for a long time and you've neglected it, just straight up neglected it. You know,
Sure.
it could be anywhere in that spectrum where now
Mm,
you've adopted it and it's now you've adopted this problem, or you've created the problem yourself. And you have this big group of patients that are perio patients that are going undiagnosed and untreated. By the way, number one reason that dentists are sued is for undiagnosed, untreated periodontal disease. So this is a
geez.
legit problem.
Yeah.
So now what do you do? So now you're like, okay, I want to tackle this problem. Well, here's the paradigm. How do you have that discussion with your patients? How do you say, oh, you have periodontal disease? And they come back and say, well, I didn't last time. And you're like, well, actually you did, you know,
Well,
or
diseases, yeah,
you
come
didn't,
and go or come and
yeah,
stay.
you had it 5 years ago. And they're like, well, why did no one tell me? Right.
Yeah,
So
sure.
there lies in the paradigm. And it's this ugly situation.
Mm,
Now you've got to know what to say, train your hygienist what to say, train your front desk what to say, so that you can get them on track, diagnosed and treated, but not hang yourself out to dry or put a noose on your neck, you know, to
sure.
just absolutely, you know, destroy your credibility. And so there is a pathway through all of this, but that's what it is it's finding yourself in this situation where you're like, crap, I have this 30%, 40%, 25, whatever percent of my patients that are undiagnosed and untreated. We know it's there, or maybe you don't even know it's there. That's part of the paradigm in and of itself, is you don't even
Sure.
know. So like we were talking about. And so how are you going to address it? How are you going to fix this in your practice? The crazy thing is, Jordan, is that that's a big revenue builder. Like
Yeah.
there's money to be had in treating periodontal
Yeah,
disease.
you're
And
solving a big problem.
yeah, it's in dentistry, we're so apologetic in dentistry, you
So
know.
silly.
Oh, yeah, it is. It's like I don't ever go to the hospital when I'm sick
Oh,
and expect
sorry.
them to do me some big favor. You know what I mean? Like I
Yeah,
don't.
sure.
But for some reason, when patients walk in our door, we feel beholden to some abnormal, like I always tell my staff, like, you didn't put that there. You didn't tell them to neglect that, or you didn't tell them to go at the skate park and wipe out and bash your face on a piece of concrete. You know what I mean? Like this is not, we didn't do this, but we are here to help. We are here to treat and help and to make the world better
Is it
one
almost
patient at a time.
is it almost like the average dentist has an overdeveloped sense of responsibility for the what the patient is maybe thinking or feeling like, oh, well, the doctor said so, it's the doctor's fault, or something like that. Seems like a silly mindset to have when you as practice owners and practicing dentists, you are providing a high value service for people. That's really important. Do
I
they have low
totally.
confidence in their skills or when in the profession of dentistry? Like, what is it?
I think that's part of it. And then I think the other
Hmm,
part of it is that we haven't done a good job of training our patients
I see.
as a whole to
Yeah,
value their oral health like we should. And
sure.
so when they go into the hospital with some kind of ailment or problem or issue, they hold that to a much higher value than when they come into a dental office, even if it's an emergency,
Mm,
because it's lower rent. They're like, oh, well, I've had teeth pulled in the past. And, you know, generally it's not life threatening either, you know, which is good for us.
yeah.
Uh,
But I mean, you're
but
literally going like chomping on those things every day, like they're tools. So
yeah, it's a
really
life.
important.
I think people equate it with a lifestyle, almost like a luxury, you know,
Yeah, it's
like,
interesting.
oh, well, having teeth is a luxury. No, it's not. Like,
No, we should keep them. Yeah. So it sounds like it's a patient education issue on the practice to patient relationship side. And it sounds like it may be an education issue with the hygiene world, maybe.
100%.
Interesting.
Yep. Yeah.
Oh,
It's
and then I was thinking when you're talking, is it also a fault of like, is it hard to track like in the practice management system? I don't know. What do you see in this? Because one of my thoughts is like, oh man, it seems like it's really hard to track. Like, is the practice management systems not equipped to help doctors see it better and hygienists see it better?
So what we've seen is that generally, no, it's usually a human
Okay.
error.
Okay.
I'll give the example of our own practice. And there, a few years back, we got a report from Burkhart. They ran
Mhm.
just a general kind of health report for the practice, and our perio numbers came back, and we're like, Dr. Hill and I were both just like floored. We're like, there's no way this is right. But we didn't know. We were ignorant because it's the bandwidth. You and I have talked about that bandwidth problem.
Yeah.
So many docs have such a bandwidth problem, and we have reports, we have these things that we can go and look at, but at the end of the day, after like just today, Jordan, I'm still in my scrubs.
I
I
know
just got
I
done
should
with
have matched you today.
yeah, I just got done with 2 implant cases and a third case. I just took out some wisdom teeth on a young gal. So, I'm coming straight from doing that to this,
Yeah,
and
sure.
I'm not alone. Like there's so much stuff going between, kids' sports and, I've got to
Family
do this and
life,
I'm volunteering
podcast
here.
life.
Yes. Living this podcast life.
It's difficult.
But everyone feels that, right? And
Sure.
I think that dentists being expected to wear multiple hats, the burnout factor is high. And so something's going to give. And I think that what often gives is the attention to the business itself, the practice itself.
Sure.
And so reports go unrun and data goes unlooked at. And what ends up happening is you find yourself in a situation where let's just take the perio situation, where now I get a report from somebody and I look at it and I'm like, whoa, my perio numbers are super low. And then you start digging and you go, like what we did in our office, we start digging and go, why is there's no way that, we're this low in perio. So we went digging through the data. What we found is we had a couple hygienists that the patient said, well, I don't want to pay for SRP. I don't want to pay for perio maintenance. And so they're like, okay, well, I'll just put you to prophy. So it immediately in our system, when you do that, it
Oh,
takes
so it
them
is a
out of the
financial.
recall.
So it's
So
education and financial. So it's patients being, hey, I don't want to pay for this, which is interesting. So lack of education and benefit to the patient, and then of course, like, why are we allowing patients to say you're you're the experts in the field? Why are we allowing them to say, well, I don't want to do it? It's like, well, you need this to stay healthy because this is going to create some serious problems as you age if you don't take care of it.
totally. I mean, you can compare it to physical therapy. If you go and
Yeah.
I've had knee surgery before, right? So,
Yeah.
and there's rehab after. I could
Hmm.
have said no, like, I don't want to pay for that. No, I was
Yeah.
just doing
I'll do
something
it on
else.
my own and then you don't do it.
How hard can it be,
Yeah.
And there's
Okay.
there's going to be obvious consequences to making those choices. But
Yeah.
again, it's the mindset of, oh, well, this patient, I don't like what we're charged. I don't like that I have to charge this patient. You didn't put the periodontal disease there. So that's step number one, is
Yeah.
to,
You're not the bad guy.
like, you're not the bad guy. We're here to help.
Uh-huh.
But helping, we're also, we went to school to make a living. And so you can't just do everything for free. And so that's the second component, is that if you don't value your work, nobody else will. That's for sure. If you discount the crap out of everything and give everything away, that's going to become an expectation for people that see you. And then
Yeah.
B, you're going to discount and devalue the entire field, especially in your office. And that sends a message to the rest of your team that your time and their time is not worth that much. So you have to begin, and that's one of the things that we actually have, like, factors that contribute to the Perio paradigm. And one is lack of team empowerment. They don't feel, either they're not educated or there's a culture that exists or whatever, that they feel guilty about putting a patient into the perio maintenance and treating the periodontal disease. It's the oddest thing, because they're like, well, they don't want to pay for it. And it's like, that's fine. They don't have to pay for it. They need to sign this waiver that says, so we have a form that it's actually legally, we have them sign it so that if
Sure. Smart.
they end up having issues, we can say, no, you signed this paper that's acknowledged you have periodontal disease and you would not treat it. And if they continue to neglect it, we dismiss them, because
Yeah.
we don't need that headache in
Well,
our
it all
office.
goes back to our conversation yesterday on ideal patient profile, right? If the patient's not going to care for themselves, It's like, do you really want to track those types of patients? That's really
Yeah.
difficult, it sounds.
Yeah.
And a legal issue if you're not taking care of that process.
Exactly, exactly. So yeah,
So
to get more granular on this, Jordan, I think,
yeah.
just to lay it out, there's basically 7 things that contribute to the Perio paradigm. One is that we talked about that lack of team empowerment or education.
Okay.
Either they don't understand like their role, or that they've become maybe institutionalized in another office that they worked in or whatever, but they come in with these set notions or ideas of how things are done. And if that isn't corrected, then you're going to bump into it. The other thing is they have to be empowered to know how to navigate and have those conversations with the patient and
Yeah.
have that, hey, you have periodontal disease. People are scared to tell patients that they have a disease process. Like, yeah, no one
Yeah.
likes to be the bad guy, but it's a lot worse to leave it alone. So,
Sure.
they have to have that empowerment, and that's going to come from confidence from the doc. If the doc doesn't have confidence in doing it, and the way you do it is you be blunt. Like, I don't want to go see my physician if I have some big issue and have them tippy toe baby my way around it. I want them to be like, you have coronary artery, you have you're going to have a heart attack,
It's what you got to
or
do to help yourself, dude.
yeah, you have high cholesterol,
Yeah.
so I don't want to understate how important this is, that you just have to be direct. That doesn't mean be rude or, anything else. Just be direct.
Yeah, so let's call that being assertive, which is believing in what you're helping and then just being really upfront on getting the patient to say yes and get treated. Like that's being assertive. There's nothing wrong with that. You're not being rude or aggressive. You know what I mean?
Totally. Yeah, 100%. Yeah, the second issue is diagnosis, just
So
diagnosing it.
diagnosis, okay.
And
So getting missed by hygienists is so lack of education there for the hygiene department.
it's usually a combined thing. Again, this
Okay.
comes back down to culture, and if the team isn't empowered, they won't diagnose. They'll probe and they'll be like, he's got 5s and 6s all over the place.
Oh, but then
But
they're like, whatever. They got 5s and 6s, and the patient's not gonna know what that means.
yeah, yeah.
Right.
And they're like, hey, you have 5 and 6 pockets. Oh, all
Patient's
right.
like, cool, there's pockets in my mouth.
All right. Some pockets.
Yeah, I thought it was
Like,
just gums and
what
teeth.
can I store in those pockets, right? Like,
Yeah, is there money in them to pay for perio?
yeah. So I mean that's a
hmm,
big issue. And then so if
okay.
the dentist doesn't, so there, what we recommend on that is that if let's say a new patient comes in, right? And the hygienist is in our office, the hygienist sees our new patients first. So
Mhm.
so that they can get all the data collection and do
Smart.
yeah, we need to see the perio numbers, right? Before we walk in the room. So imaging is done, perio numbers are done. We walk into a room, hygienist tells us, oh, Mr. Smith has, you know, um, 5s and 6s in 4 of the quadrants. Oh crap, Mr. Smith, you have periodontal disease. Blunt.
Yep.
And then I don't ever ask them, like, don't ask your patient if they know what periodontal disease.
Yeah, because they don't.
Don't be demeaning. Like, yeah, there's a time to mansplain
They're
things,
not
a time
dentists.
not
Yeah.
to.
Mansplain. Yeah, sure. Yeah.
And
There's always a
this,
time and place for that.
yeah, this is one of those times where you need to bust out the mansplaining card, and you need to say, hey, periodontal disease. Listen, I just want to be clear on what this is. This means that you have the tissues that support the teeth and hold the teeth inside the bone are degrading. And then you can get into why and of all that stuff, but just keep it simple and keep it direct. And if you do that in front of your hygienist, that empowers them. They then feel confident in having that discussion because you just did.
Mhm.
So it's an easy thing to have. Some hygienists are bomb at this. They are so good at it, and they will set the stage beautifully. Before we have some rock star hygienists in our office that they have no qualms of talking about it. They love it. And
Yeah.
so when
Yeah,
we
you're
walk
helping
in, it's like,
people.
yeah, you got a disease, bro. So that's a big part, is just the diagnosis. Treatment acceptance is the other thing. Like we talked about that a little
Okay.
bit. Where people are bumping into like, ooh, yeah, I know, but it doesn't hurt. So I'm not going to do anything about it. It doesn't bother me,
Mm.
and so I'm just going to leave it. And so that's when we run into like, okay, then I need you to fill out, this is how serious we take this. You're going to need to sign this disclaimer and this release because you have a disease process that's going to lead to you losing your teeth and having potential infections. So we can't carry the liability on this. You need to accept this and sign this and say it's on you, not on us.
Yeah. No,
And
that's great, that process.
yeah, that's something where like, hey, this is how severe this is. Like you're basically waving off the fact that you have a severe disease process going on.
I remember at the dental lab, quick story, because I used to look at impressions every day, right, of people's
Yeah.
teeth, right? They were yellow impressions or blue, the colors of the stone, right? There's
Oh
yellow
yeah.
and blue. At least that's what we used at the dental lab. And I remember physically or visually seeing, hey, this patient has perio. Like I could see that just from the model and like how it has a certain look, right? At least the advanced stages of it has a certain look. And I remember one of the doctors calling us one time, taking an impression, and the tooth just fell out because they had really bad perio, and the tooth just came with the impression. I'm like, geez, is this person being treated, or are we just doing restorative care on them? Because they're just not taking care of it. That's kind of what I remember seeing at the dental lab a lot on the like denture case, like partial cases and things like that. Primarily partial cases, we saw a lot of perio issues, at
Dude,
least
you
from my
just hit on a
memory.
huge, like, so that is one of the things that can be super bad if perio goes undiagnosed and untreated is if,
Hmm.
let's say someone comes in and they have, you know, I don't know, stage 3 perio, right? And
Sure.
so, um, and then all of a sudden a bunch of restorative work gets done because that's what the patient wants. The patient says,
Yeah.
that's what I want, but they're not informed or understand clearly that you're basically building a house on a crap foundation. My
Yeah. I remember
roommate
creating
loves to say,
restorations on those types of patients. And I'm just like, man, it seems like their mouths changed quite a bit too, because the bone structure, as you mentioned, gets probably weaker and changes and adapts. And I remember even seeing, even with like denture patients, their mouths change like crazy without the teeth inside their mouth. They
well,
change drastically.
this is what happens is let's say they move, right? So
Hmm.
that patient moves and they come and see, Dr. Newtown,
Okay.
and that guy's like, oh, I see you've just, what's the history on all these crowns? You got 5 new crowns, and they're like, oh, well, my last dentist just did that last year. Okay. You have periodontal disease. Oh, well, did that just happen? Can that just happen like within the last year?
No,
Mm, probably not to this extent. So why didn't my
sure.
last dentist diagnose and tell me I had periodontal
Jeez.
disease? I don't know.
I don't know
Like,
about him. I don't know.
I'm not sure. Well, should he have done that?
Uh,
Like then you're in this awkward,
yeah,
horrible,
that's
yeah,
awkward. Especially if it's like one of your buddies down the street. It's
oh,
like,
dude,
oh,
it's the
I
word.
like
Like you're like,
Dr.
and so and then what they'll go back and be like, well, why didn't you tell me? And it's a potential lawsuit. And
Yeah,
so
interesting.
this is where how it plays out. Usually it's someone that moves or transfers to a different office. They're diagnosed with it in the new office, and they go, why didn't my old dentist tell me that this was what was going on? And they're like, and at that point, now you're at this really, really crappy crossroads where you're just like, I don't know. And you just, I don't know. I don't know what happened. But then that patient, depending on how disgruntled they are, something can happen from it. So it's a serious deal.
Sure. Yeah.
But kind of moving on beyond that,
Yes, you're seven. You're seven.
yeah, this is number 4 is scheduling.
Okay.
So let's say like our office is booked out for 6 months in hygiene. And
Okay.
this is common. A
Yep.
busy office tends to be booked out, for at least 6 months. It's not uncommon for them not to be able to even get all the active patients in. And so they're like, well,
Hmm.
I don't diagnose it because I can't get them in for SRP
Oh,
because
interesting.
SRP is 2-hour block,
Yeah.
or hour and a half block, whatever the hygienists want. And that if it's assisted hygiene, that's a little bit different. But, so I don't know what to do. And that's a problem. And then the front desk will push back and say, well, you can't keep diagnosing all of these perio patients because we have nowhere to put them.
Hmm.
So now they're
Bandwidth.
diagnosed, but they're untreated. So that's an issue still. You still have a problem. Like it's like, okay, what do we do? And this, again, I'm not going to get too much into this, but it has to do with smart scheduling, something called smart scheduling.
Okay.
Smart scheduling is just simply blocking out specific times. If you know what your perio percentage is, you can look at your blocks
Mm.
in your schedule and block out that same percentage of time into your schedule. I'll just simplify it really quickly for anyone that's listening to this. That's a quick and dirty way that you can go about doing it. But again, if you don't know your data, if you don't know what it is, you're not
Yeah.
gonna. So
Sounds like a topic we'll go deep on another episode here.
yeah, that's one of my favorite things to talk about.
Sweet.
So yeah, scheduling is an issue, and that's one of the contributing factors. Number 5 is the reappointment. Okay, so this is what we see happen. I alluded to this earlier, and this is probably the most irritating thing to any doc regarding the Perio paradigm. So what happens is, so we had a hygienist several years ago who took it upon herself. She was the same one that I was talking about with the patient would say, I want to pay for it. And she'd be like, okay, well, I'll just do a cleaning then.
Jeez.
So she would take them out, but in our system, when you kick them out of it automatically takes them out of the perio pool as soon as they go into a normal prophy. So it bases it on the code. So if they have an adult prophy, it'll kick them out of the perio pool. So, and then it automatically sets them up for a 6-month recall. So she did that constantly. And she would wave us off. We'd come by. Oh, you ready for an exam? Nope, we're good. And with multiple docs, you don't know if another doc has already been in there. You didn't know, like, we didn't know if the patient was short for time. We would just get waved off. We didn't get waved off a ton, but she was by far the worst. We got waved off.
Yeah. Hopefully you were tracking it. Yeah.
Yeah. Oh yeah.
Sounds like you were.
Yeah. So when we got the report from Burkhart, we went back through, and sure enough, her patients consistently used to be perio and now we're not. So now we fired her, and
As you should.
yeah. And once we went back in, we had to have this awkward conversation now of like, you know what, you have periodontal disease, you've slipped through the cracks. This is something that is not okay with us. You've been getting away paying for just normal prophies, but you really need to be, scaled and be on a more regular maintenance, a 3 or 4 month regular maintenance recall. And some patients were like, what happened? Why did that happen? You know what? I'm not completely sure, other than it looks like something happened in our system, and in our system, it resets you and kicks you out of the perio pool. For that, we just need to get you back in because I want you to be treated correctly. And that was the conversation we would have. And I had to have it a lot. Dr. Hill had to have it a lot, where it's like, we got to get you back on track. And again, you got to train your staff how to have that same conversation. And there's ways to say things and ways not to say things. You don't want to point the finger because you don't always know what happened. What I mean? Like, the data tells us a lot, but it doesn't always tell the story.
Yes.
That maybe the patient was being, adamant, just saying, I'm not paying for this crap, blah, blah, blah. And they're mad and they're frustrated and they're freaking out that they have a disease.
Yeah. It can be scary. Yeah.
Yeah. It's scary.
These
like
words,
someone tells you have a disease, like, who wants to hear that?
Yeah.
And so everybody reacts different. So we don't know the story. So you have to be careful about, you don't want to throw your staff under the bus. You don't want
sure. Yeah.
you just have to navigate that carefully. So there's verbiage, very specific verbiage that we have written out for our team.
That's good.
Address that. The next thing we have is buy-in. And we've been talking about this the whole time, Jordan, is
yes.
What's this idea of buy-in? Well, the patient has to have buy-in. You have to have buy-in.
You got to believe in your service. Yes.
And then your team has to have buy-in. And so we kind of beat this dead horse already, so we won't kick it too much more, but I think that the message is received. And then the contributing factor is, and we've talked about this a bit too, is cost. And that's where insurance comes into it, because sometimes insurance is less than stellar about how they address it or how it's worked in, or when the benefit's up, will they continue to get care? And it's going to cost more. That's the thing, is like, you have a disease, treating disease costs more. Prevention is so much cheaper.
Yep. Oh, yeah. Because then surgeries and restorative care, like, that gets really costly.
Exactly. Yeah, so this is something that your team just has to understand that, like, yeah, you're treating disease. That costs money to treat disease, and it sucks, and no one loves it. But you know what's awesome is that we're empowered. We have the ability and the training and the education to treat this and to stop it. And so I think that that's really, really important to the empowerment component.
Yeah, no, this has been really good. So I guess the objective of this podcast today is turn your perio paradigm into perio paradise. That's
Yeah,
a lot of
yeah,
piece.
yeah. You need
So
to
no,
explain the background on Perio Paradise.
yeah. A couple of thoughts on that before we end the episode. The last one, of course, is where my mind goes to from my I guess, uh, contributions in the dental industry is cost, right? Cost is really interesting. We see a lot of practices to solve for that. They create a Perio membership plan. I don't know if you guys have one at your guys' office or you include Perio benefits in your existing one. There's
We have it
many
rolled
ways.
into our, yeah,
Cool.
ours is rolled in.
There's usually two ways to do that to help cover the cost for patients and really get them in. So the first way is to have Perio benefits rolled into your existing preventative care membership plan. Another way to do that, which is really popular and helpful, is to have a separate. You have your hygiene plans, right? That covers 2 exams and your basic preventative care for most patients. What a lot of other practices do is they'll create a perio maintenance specific membership plan, which includes like, let me read my notes here. I wrote some down. It includes the perio, all the maintenance cleanings in the year, right? And usually these are higher monthly or yearly subscriptions that the patients take care or cover. But it's done in a subscription, right? Whether it's monthly or yearly, it's an easy way for the patient to say yes to treatment if that's an issue in your office. It's an easy way for you to display what they get for the money they pay, right? That's why I like the membership plan component in regards to perio. So they get the periodontal maintenance cleanings per year. Well, then you can set it up in tiers, right? You can have a basic cleaning based off what they need. You can have a basic perio plan, a advanced, which is typically includes 4 periodontal maintenance cleanings per year, discounts between 15 and 20% um, on periodontal treatments like deep cleaning, gum surgery, or laser therapy is kind of what most practices do. Really depends on what other offerings you have for the patient in regards to a perio, and then emergency exams as needed, right? So there's some similarities between like a normal preventative care membership plan, but this one's more geared towards perio. And we've had a lot of practices offer these types of plans, and they do really well within the BoomCloud platform. In fact, I had a employee years ago who got diagnosed with perio, and he came in. He's like, I don't know what this means. I don't know what to do. I'm like, oh, let's go look at what this practice is doing in their membership plans. And we actually helped the practice create a perio plan for our employees if they needed it. And he joined. And of course, as one of our team members, BoomCloud pays for BoomCloud membership plans with BoomCloud practices, right? But he started going, and he was able to take care of it easily by joining the Perio membership plan. So that's an easy way to get around the cost conundrum, right? Or even the insurance conundrum. A lot of practices are doing that. I wish I had more stats. I'll post some stats across our entire platform and on how many patients are on Perio specific membership plans and what those kind of look like. I'll maybe show those in the show notes. So Bentley, as you're listening to this, make sure you listen to this part and put those in the show notes, bro. Anyways, that's kind of where my mind goes on this topic. I think this has been an awesome episode, Dan. I think a lot of practices really needed to hear the Perio paradigm and how to avoid it. I would imagine too, one of my other thoughts that I was thinking, I know you guys use EOS to manage your practice, which stands for Entrepreneur Operating System. I would imagine in your meetings where you're looking at the data that you've got Perio numbers in there that you're looking at some type of Perio patient metric.
Oh, brother.
That's
Yeah.
just my thought.
You want to open up that giant floodgate?
Yeah.
So we actually operate off of what we call EAOS, Elevation
Sweet.
Association Operating System.
Nice. Like that.
It's a derivative of that. It's definitely the
Sure.
bones are EOS.
Yeah. We operate a similar way at BoomCloud. So that's why I
Yeah.
like you guys.
Yeah, it's so we track Perio for all of our clients. You know, it's important. Our EA members, we really we do yearly growth reports so they can look at that, but every week, depending on the membership plan they're on, we either monthly or weekly go through, or yearly go through, and want them to see those numbers.
Sure.
We at EA, at Elevation Association, we use Dental Intel.
Uh-huh.
There's other good programs, Practice by Numbers, other things
There's
that
a
are out
ton out there. Yeah.
Jarvis, there's other stuff that's available if people want to use it. But for us, we found Dental Intel to be super user friendly and parties nicely
Sure.
with other operating systems. And so,
Yeah.
but we track, that's one of our key metrics that has to be tracked. And we look at it every week with our teams and with our members and say, okay, where are you at? And if it's low, we create an issue. So as you know, with EOS or EAOS, one of the big things that's a component of this is level 10 meetings. And
Yes.
if you're not, by the way, we should have a whole, I mean,
We'll have a
meeting.
whole episode on this. Yes.
Yeah. You can check out our website or go to our YouTube channel to see the webinar that we just had on level 10 meetings. If you guys don't know what a level 10 meeting is, but yeah, we need to do a show on level 10, but that is something where if there's an office that we're working with, if they're below whatever threshold they should be below, like above, then that's an issue. And we have to address that and say, okay, well, why? And then again, like I'm doing a one-on-one, I'm basically doing the Perio Paradigm lecture with a office in Salt Lake City.
Oh, cool.
This next month, because he's like,
which office?
Well, I don't dare out him yet, so I'll see if he can give me permission if I can tell.
Sweet. Yeah. Next episode.
Yeah. But it was cool because he's like, he knows. He's like, look, I'm having a hard time getting my team on board with this. And he's low in Perio. And he's like, and we know it's been a problem for several years. And he got the practice from his dad, and it was an issue then. And he's like, look, I really want to get on top of this, but I'm having a hard time with the buy-in component,
Sure.
So I said, look, let's set up a Zoom. Let's do this. Like, let's have this. I'll present it. And really what
you're coaching them.
Yeah.
I thought you were speaking here in Salt Lake.
Oh, no. This is a one-on-one.
This is a one-on-one. I
This
misunderstood.
is a one-on-one. The last time I gave this lecture to a group was in Belize.
Okay.
One of our international summits in Belize.
Yeah, it's cool.
But yeah, this is intended. It's designed for us to be able to go in and have a one-on-one, much more intimate setting, so that they can kind of talk about their pain points, talk about like, I'm not comfortable doing this. We've done it with another office not too long ago. And the questions are always the same when we go in an office, and it's like, how do I have that discussion? What do I say? How do I not incriminate somebody else with it?
Sure.
And so it's nice to be able to get into that much more personal level and talk about those personal pain points, so that the hygienist specifically can move past that fear or that discomfort of having those discussions.
Yeah, this is fascinating. This has been a great episode, man. Any online resources that you have on this topic? YouTube videos other than this podcast?
We don't, other than I would say that the best thing that someone that's listening to this, if they want to know, is just contact us. We do a free growth report. It's a zero obligation. We're not looking, we're just looking to help out, and if someone needs a snapshot into what their practice is looking like, give us a jingle or email us, or just get on the website, and you can just request a free growth report there. Then you can see what your Perio numbers are, at least to the data, if your data is accurate in your whatever you're using in your operating system at work, if you're using Open Dental, EagleSoft, whatever. But at least it'll give us an idea of to be able to present to you and show you, like, okay, where are your Perio numbers? Are you even close to 30%? This is the thing that drives me crazy too, and we hear this all the time. Well, let me ask my office manager. Okay, ask your office manager. And then the office manager says, well, I feel like it's probably around 30%.
Oh, it's like a feel like it's a
You feel
feeling.
like it is. Okay.
Yeah.
Well, then it's all solved. We're
Well,
good.
I feel like I'm a billionaire, but
Yeah.
we'll see how
Yeah.
that goes.
Yeah. Well, sometimes I feel like not going to work and I still go to work. You know what I mean? Like the
Yeah.
feelings, what
Yeah, that's
it just
interesting.
the feel thing drives us crazy because it's so much. Basically, if you have an employee and you ask a direct question to a data component and they say it feels like this, that is them saying, I don't have a clue.
Yeah. I don't know,
So
but I'm gonna just say something because you asked.
you
Yeah,
put me on the
that's
spot.
what it
Therefore,
is.
I'm going to say it feels like this.
Yeah, I always say whenever somebody gives me their feelings, I'm like, I really don't care about your sentiments. Like, give me the data.
I'm
Give me
just,
the
I'm
like,
just,
give me what we
just a
see in the
mean,
data.
hardened dude. I don't care about feelings.
I know it's can be pretty rough sometimes. People think I'm mean, but this has been awesome. So go to get a free growth report at elevationassociation.com. Is that where they go?
Yep.
Okay, elevationassociation.com. If you're interested in growing and scaling your membership plan, whether you do Perio or other types of membership plans, go to boomcloudapps.com or boomcloud.com, both work, and schedule a demo to see how BoomCloud can help you stand up this membership plan and help you get and retain more Perio patients as well as other types of patients. But
Yeah.
due to the nature of this podcast episode, that's what I'm saying.
Yeah, and if people have questions too, like reach out and we can show how we've integrated our Perio program here into our
Yeah,
patient benefit plan, our membership plan,
that's
and we
cool.
can show how in our office at Wood River Dental, we can show you how we've integrated that and make it a part of. So we lower the threshold to say yes to treatment
Yeah,
to Perio treatment. So if people have questions on how we went about doing that and how it's
so
structured,
good.
we can help out with that too.
Well, yeah, and all your membership patients is just included if they need it, right? And they're like, oh, it's already just included, or a portion of
Yeah,
it's included, right?
but you have to be careful because you can lose your shorts on that if you don't do it right. So you have to
You
make
got to look at
sure.
the numbers. Visibility in the numbers is really important.
That's
Yeah,
right.
I love that. Okay, Dan, great episode, man. This has been awesome. Hopefully to all of our listeners, this has been a valuable episode for you, and we'll see you on the next episode. Rock on, everybody.